Hemorrhagic strokes represent a medical emergency of profound consequence, defined by the abrupt and unexpected bleeding within the brain or between the brain and the skull. This hemorrhage disrupts the normal functioning of the brain, posing a grave threat to an individual's life and well-being. The ability to survive a hemorrhagic stroke is contingent upon various factors, including the severity of the stroke and the promptness with which medical intervention is sought. Unfortunately, a significant proportion of individuals who experience a stroke succumb to its effects within a matter of days. Symptoms of a hemorrhagic stroke are diverse, often varying from person to person. These symptoms typically manifest immediately after the stroke occurs. Among the most common immediate indicators are facial drooping or numbness, an inability to move one or both arms, and slurred or unintelligible speech. Additional symptoms may include dizziness, confusion, loss of balance, nausea and vomiting, difficulties in swallowing, seizures, a sudden and severe headache, and in severe cases, unconsciousness. Recognizing these symptoms as indicators of a stroke is paramount, as strokes constitute a medical emergency. Swift action, such as calling an ambulance or seeking immediate transportation to the hospital, is crucial to facilitate timely medical intervention. Hemorrhagic strokes are categorized into two main types: intracerebral hemorrhage and subarachnoid hemorrhage. Intracerebral hemorrhage occurs when a blood vessel within the brain breaks, leading to internal bleeding. High blood pressure is identified as the most common cause of intracerebral hemorrhage. Interestingly, other types of strokes, such as thrombotic and embolic strokes, which do not initially involve hemorrhage, can contribute to intracerebral hemorrhage. Thrombotic strokes result from the blockage of an artery in the brain by a blood clot, while embolic strokes are often associated with endocarditis, a heart valve infection, where an infected clump of bacteria travels to the brain, causing a stroke. Subarachnoid hemorrhage, on the other hand, involves the accumulation of blood at the surface of the brain. The rupture of a blood vessel leads to blood flowing into the space between the brain and the skull, causing immediate headaches. In the days following the hemorrhage, the clotted blood around the brain can induce spasms in brain arteries, potentially damaging brain tissue. The causes of hemorrhagic strokes are primarily linked to the rupture of blood vessels in the brain. The most prevalent cause is the development of an aneurysm, an abnormal swelling of blood vessel walls. Aneurysms are often associated with high blood pressure or hypertension, causing the vessel walls to swell and eventually rupture. Once diagnosed, the immediate emergency care treatment for a hemorrhagic stroke focuses on stabilizing the patient and reducing the severity of the condition. Medications are often administered to lower hypertension and slow bleeding. Notably, individuals who experience a hemorrhagic stroke while on blood thinners are at a heightened risk of excessive bleeding. In such cases, drugs may be administered to counteract the effects of blood thinners while emergency treatment is underway. Surgical treatment may be warranted, depending on the severity of the hemorrhagic stroke. For cases where the rupture is small and there is limited bleeding and pressure, supportive care, including intravenous, IV, fluids and rest, may be sufficient. However, in more serious cases where bleeding persists or the pressure caused by brain swelling is not alleviated, surgical intervention may be required. Surgery aims to address the underlying causes of the hemorrhage, repair damaged blood vessels, or alleviate pressure on the brain. Post-emergency treatment is a critical phase in the recovery journey of individuals who have experienced a hemorrhagic stroke. The extent of recovery depends on various factors, including the severity of the stroke, the amount of tissue damage, and the timeliness of medical intervention. For those who do survive, the recovery period is typically long, extending over months or even years. However, if the stroke is relatively small and there are no major complications during the hospital stay, many individuals can resume a relatively normal life within a few weeks. Subscribe to our YouTube channel for more engaging videos like this.